Okay, guys, we are now starting on chapter 10, minor office surgery. This chapter is a lot to cover. I mean, a lot. However, it is one of my favorites. So, we are going to start. So, again, it is your responsibility. You need to make sure that you're reading the full chapter. I'm going to hit on the highlights, but because it is such a big chapter, I cannot stress this enough. Read this whole entire chapter, but I'm only going to hit on the highlight because I want to make sure that I'm able to at least give you everything that you're going to need to know that's going to help you with studying, answering your homework questions, and preparation for your final examination. Okay, so let's get started. On page 317, Introduction to Minor Office Surgery. The term surgery is defined as the branch of the medicine that deals with the operative and the manual procedures for correction and deformities and defects, repair of injuries, and diagnosis and treatments of certain diseases. Minor office surgery, also known as minor surgery, refers to a surgical procedure that is restricted to the management of minor conditions and injuries that do not require the use of general anesthesia. Minor surgical procedures have the following characteristics. Please highlight the following. Are performed in an ambulatory healthcare facility, such as a physician's office or clinic, can be performed in a short period of time, usually in less than 1 hour, require a local anesthetic or topical anesthetic or no anesthetic, can be performed safely with a minimum of discomfort to the patient, and do not, under normal circumstances, pose a major risk to life or to the function of an organ or body parts. All of that needs to be highlighted. If we go on over to on the other side on page 317, please highlight the following. The medical assistant is responsible for preoperative instructions, for example, explaining the patient's preparation required for the procedure, and for obtaining the patient's signature on a written consent to treatment form, which grants the physician permission to perform the surgery. That needs to be highlighted. Additional responsibilities of the medical assistant include preparing the treatment room, preparing the patient, preparing the minor surgery tray, assisting the physician during the procedure, administering postoperative care to the patient, and cleaning the treatment room after the procedure. Again, that needs to be highlighted. I want you to go ahead and go on down and highlight where it says the medical assistant prepares the minor surgery tray using sterile technique. Now let's go on over to page 318. We'll start with surgical asepsis. Surgical asepsis, also known as sterile technique, refers to practices that keep objects and areas sterile or free from all living organisms and spores. Surgical asepsis protects the patient from pathogenic microorganisms that may enter the body and cause disease. It is always employed under the following circumstances. Please highlight the following. When caring for broken skin, such as open wounds and suture punctures, when a skin surface is being penetrated, as by a surgical incision for a mole removal or the administration of an injection, the needle must remain sterile. And when a body cavity is entered that is normally sterile, such as during the insertion of a urinary catheter, that needs to be highlighted. If we go on over down to the next paragraph, please highlight where it says a sterile object that touches any unsterile object is automatically considered contaminated and must not be used. If the medical assistant is in doubt or has a question concerning the sterility of an article, he or she should consider it contaminated and replace it with a sterile article. And then I want you to review and highlight where it says the guidelines for surgical asepsis. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Please review all of that. Now we're going to go on over to page 319 under scalpels. A scalpel is a small, straight surgical knife consisting of a handle and a thin, sharp steel blade. That needs to be highlighted. Now we're going to go on down to scissors. Please highlight where it says scissors are cutting instruments that have a ring handles and straight STR or curved CVD blades. Both blade tips may be sharp, SS. Both may be blunt for BB, or one tip may be blunt and the other be sharp for BS. Please highlight where it says operating scissors, suture scissors, bandage scissors, and dissecting scissors. If we go on over to forceps, please highlight where it says forceps are instruments for grasping, squeezing, or holding tissue or an item such as sterile gauze. Then I also want you to go on down and highlight where it says thumb forceps. Tissue forceps have teeth. Splinter forceps, dressing forceps, hemostatic forceps. And then I want you to highlight where it says hemostats are used to clamp off blood vessels and to establish hemostasis under the vessels can be closed with sutures. And then if you go on down to the mosquito hemostatic forceps have small, fine tips and are smaller and more delicate than standard Kelly hemostatic forceps. That needs to be highlighted. If we go on over to page 320, please highlight sponge forceps as well. Needle holders, retractors. And then I want you to become familiar with figure 10.3 on page 320 and 321, continuing to page 322 and 323. And then now we're going to go on over to page 324 for the gynecologic instruments. Please highlight where it says a speculum, uterine dressing forceps, a uterine tentaculum, and a curette. Now we're going to go on down to the care of surgical instruments. Please highlight number 1, 2, 3, 4, 5, 6, and 7 and review that carefully. And then we're going to go on over to the commercially prepared sterile packages. Commercially prepared disposable packages are used frequently and contain one particular article such as sterile dressing or a complete sterile setup. For example, one of the removal of sutures. The directions for opening the package are stated on the outside of the package. They should be followed carefully to prevent contamination of the sterile contents. The procedure 10.2 describes opening a sterile package. Please review that. Please highlight the following. One type of commercially prepared package is a peel-apart package, commonly referred to as a pill pack. This type of sterile package has an edge with 2 flaps that can be pulled apart in the following manner. Grasp each unsterile flap between your bent index finger and extended thumb and rolling your hands outward, pulling the package apart. The inside of the wrapper and the contents are sterile, and to prevent contamination, they must not be touched with bare hands. The medical assistant can place the contents of the pill pack directly on the sterile field by stepping back slightly from the field and gently ejecting or flipping the contents onto the center of the sterile field. Procedure 10.1, applying and removing sterile gloves. Please review that. And then if we go on over to page 329, procedure 10.3, pouring a sterile solution. Please highlight number 2, 4, and 5 on that. And then also, please don't forget to review procedure 10.2 on opening a sterile package. If we go on over to page 330, we're going to start with wounds. A wound is a break in the continuity of an external or internal surface caused by physical means. That needs to be highlighted. There are 2 types of wounds, closed and open. Highlight a closed wound involves an injury to the underlying tissues of the body without a break in the skin surface or the mucous membrane. An example is a contusion or a bruise. A contusion results when the tissues under the skin are injured and is often caused by a blunt object. Blood vessels rupture, allowing blood to seep into the tissues, which result in a bluish discoloration of the skin. If we go on down a couple of sentences, please highlight open wounds involve a break in the skin surface or mucous membrane that exposes the underlying tissues. Examples include incisions, lacerations, punctures, and abrasions. Please highlight the incision, the laceration, and the puncture, and the abrasion, continuing on page 330, and the meaning of each of those. Wound healing. The skin is a protective barrier for the body and is considered as a first line of defense. Please highlight that. Also highlight where it says the body has a natural healing process that works to destroy invading microorganisms and to restore the structure and function of the damaged tissue, as is described next. Please highlight phase 1, which is also called the inflammatory phase, begins as soon as the body is injured. The phase lasts approximately 3 to 4 days. During this phase, a fibrin network forms, resulting in a blood clot that plugs. That needs to be highlighted. Also highlight where it says the inflammation is a protective response of the body to trauma, such as cuts and abrasions, and to the entrance of foreign matter, such as microorganisms. That needs to be highlighted. You also need to highlight the 4 local signs of infection are redness, swelling, pain, and warmth. In phase 2, which is also called the proliferative phase, and typically lasts 4 to 20 days. During this phase, fibroblasts migrate to the wound to begin synthesize collagen. That needs to be highlighted. If we go on over to page 332 on phase 3 is also known as the maturation phase, begins as soon as granulation tissue forms and can last for 2 years. During this phase, collagen continues to be synthesized and the granulation tissue eventually hardens to a white scarred tissue. That needs to be highlighted. If we go on down to the wound drainage, the medical term for drainage is exudate. An exudate is material such as a fluid in cells that has escaped from blood vessels during the inflammatory process. You need to highlight where it says the serous, the sanguineous, and the purulent exudate. You also need to go on down and also highlight where it says in addition to the exudates just described, mixed types of exudates are often observed in a wound. A serosanguineous exudate consists of clear and blood-tinged drainage and is commonly seen in surgical incisions. A purosanguineous exudate consists of pus and blood and is often seen in a new wound that is infected. Sterile dressing change. Please highlight the following. The medical assistant must take care to prevent infection in clean wounds and to decrease infection in wounds already infected. The function of a sterile dressing is to protect the wound from contamination and trauma, to absorb drainage, and to restrict motion, which may interfere with proper wound healing. Please highlight where it says the sterile folded gauze pads, non-adherent pads. And then I also want you to highlight on page 334 on number 12 procedural step. Please highlight number A and B. And then if we go on over to page 335 for the sutures, please highlight insertion and removal of sutures are commonly performed in the medical office. Sutures may be required to close a surgical incision or to repair an accidental wound. The approximate or bring together the edges of the wound with surgical stitches and hold them in place until enough healing has taken place so that the wound can withstand ordinary stress and no longer needs support from the sutures. That needs to be highlighted. Now we're going to go on down to types of sutures. Sutures are available in 2 types, absorbable and non-absorbable. Absorbable sutures are made of a material that gradually digests and absorbed by the body in a relatively short period of time. Highlight where it says an absorbable suture consists of a surgical gut, a surrogate gut, or synthetic materials such as polyglycolic acid, Dexon, be Dexon, Vicryl, PDS2, Maxon, Monocryl, Polysorb, and Capricin. A surgical gut is made from sheep or cow intestine. All that needs to be highlighted, and I've been fortunate to have worked with all of those. They are wonderful. Now we're going to go on down to non-absorbable sutures. Are not absorbed by the body and may remain permanently in the body tissues and become encapsulated by fibrous tissue or may be removed. For example, the non-absorbable sutures consist of soft silk, ethylene, and proline. That needs to be highlighted. And if you look on figure 10.7 on page 336, this kind of gives you an example of what some of those suture names look like. Suture size and packaging on page 337. Please highlight where it says the diameter of the suture material increases with each number above 0 and decreases with each number below 0. If the size of a particular suture material ranges from 7.7 to 0 to 5, available sizes include 7654320 or 706050403020, 1, 2, 3, 4, and 5. Size 7 sutures are very fine sutures, and size 5 sutures are very heavy sutures. Please highlight that. For sutural needles, please highlight a needle with a sharp point is a cutting needle, and one with a round point is a non-cutting needle. A suture may be curved or straight. Curved needles permit the physician to dip in and out of the tissue. A needle holder must be used with a curved needle. Swagged means that the suture and needle are one continuous unit. That also needs to be highlighted. Please highlight also where it says the swag suture packets are labeled to specify the gauge, type, and length of suture material, the type of needle point, cutting or non-cutting, and the needle shape, curved or straight. Continue on page 338, and if you look in figure 10.9, that kind of goes into that as well. If we go on over to page 339, suture removal, the very last paragraph, please highlight where it says the physician determines the length of time, but in general, skin sutures inserted in the face and neck are removed in 3 to 5 days, and sutures inserted in the other areas such as the skin of the chest, arms, legs, hands, and feet are removed in 7 to 14 days. Surgical skin staples. Surgical skin staples are often used to close wounds. Stapling is the fastest method of closure of long skin incisions. That needs to be highlighted. If we go on over to page 340, under the adhesive skin closures, please highlight, it will be the second paragraph, where it says the advantages of adhesive skin closures are that they eliminate the need for sutures and local anesthetic. They are easy to apply and remove. They have lower incidence of wound infection compared with sutures, and they result in less scarring than sutures. An example of adhesive skin closure in different sizes will be figure 10.12. It's what I also like to call steri-strips. In the very next paragraph, please highlight the following. The medical assistant frequently is responsible for applying adhesive skin closures. Procedures 10.6 outlines this procedure. Approximately 5 to 7 days after application, the skin closures usually loosen and fall off on their own. That needs to be highlighted. And I do want you guys to know that medical assistants are used to removing sutures and staples. It's very common. So I would advise that you guys read this chapter very carefully and become familiar with all of the procedures and the pictures and everything inside this chapter. We are going to be going on over to page 347 for assisting with minor office surgery. For the tray setup, you need to highlight where it says assisting with minor office surgery requires a thorough knowledge of the instruments and supplies for each tray setup and the type of assistance required by the physician during the surgery. That needs to be highlighted. If we go on over to the other side on page 347, the methods used to set up a sterile tray, please highlight where it says the medical assistant opens the wrapped package on a flat surface, such as a Mayo tray. A Mayo tray is a broad, flat metal tray placed on a stand that can be used to hold sterile instruments and supplies. This is very commonly in the medical offices. Then we're going to go on over to page 348 for the side table. It needs to be highlighted. Some articles required for minor office surgery are not placed on a sterile field, but they are not set on an adjacent table or counter. Shaving the site, please highlight that hair supports the growth of microorganisms, and the physician may want the medical assistant to shave the skin and around the operative site. I have had to do this several times. And then if we go on down to cleansing the site, the operative site must be cleaned with an antiseptic solution such as providine iodine or betadine surgical scrub or chlorhexidine clonate Hibiclens. That needs to be highlighted. If we go on over to the other side on page 348 under figure 10.14, please highlight that a disposable sterile fenestria drape is a type of drape most commonly used. It has an opening that is placed directly over the operative site. Again, this is something that is also very commonly used. For local anesthetic, please highlight the following. The physician injects the local anesthetic into the tissue surrounding the operative site, a process termed infiltration, to produce a loss of sensation in the area and to prevent the patient from feeling pain during the surgery. When first injected into the tissues, lidocaine causes the patient to experience a brief burning or stinging sensation at the injection site. The local anesthetic begins working within 5 to 15 minutes and has a duration of action to 1 to 3 hours depending on the type of anesthetic. Please continue to highlight where it says epinephrine is a vasoconstrictor that prolongs the local effect of the anesthetic and decreases the rate of systemic absorption of the local anesthetic. It accomplishes by constricting blood vessels at the operative site. I have actually, especially when I worked in dermatology, me as a medical assistant did the providing the local anesthetic, and we used epinephrine in most cases, unless the patient was allergic or could not or had an allergy to epinephrine, and then in which case we would use lidocaine. So make sure that you highlight all of that. Figure 10.7 on page 352 is assisting with minor office surgery. Please review that where it continues on over to page 355. Make sure that you review that. We're going to be looking in page 356 for a sebaceous cyst removal. A sebaceous cyst, also known as an epidermal cyst, is a thin, closed sac or capsule located just under the surface of the skin. That needs to be highlighted. We're going to go on down to almost the last sentence of that paragraph and highlight where it says this type of cyst can occur anywhere on the body except on the palms of the hands and the soles of the feet. These areas do not contain sebaceous glands. That needs to be highlighted. And the very next paragraph, I want you to highlight where it says, because it is difficult to remove an infected sebaceous cyst, the physician usually drains the cyst and allows it to heal and then performs a cyst excision at a later time. If you look onto figure 10.18, figure 10.19, and A and B on page 357, that kind of gives you a little visual on how that works. On 357, under a surgical incision and drainage of localized infection, an abscess is a collection of pus in a cavity surrounded by inflamed tissue. That needs to be highlighted. Also highlight where it says a furnicle, also known as a boil, is a localized staphylococcal infection that originates deep within a hair follicle. Some refer to this as an ingrown hair, but that's actually not always the case, but that may be more familiar. If we go on over to page 358, under the procedure for an incision and drainage, please highlight number 1, 2, and 3. But also make sure that you review number 2, where it says either gauze packing or a rubber Penrose drain is inserted into the wound to keep the edges of the tissue apart. This facilitates drainage of the exudate. Because the fact that the outer part of the skin heals faster as well, the provider may, what we call packing, may place packing to allow the wound to continue to drain, but also allow the wound to heal from the inside out naturally like it should. If the outside of the skin heals before the too fast, it'll basically just recause a boil or an abscess, whichever the case may be. So you will see that a lot, and a medical assistant actually is also able to place a packing inside the wound. So become familiar with that. For a mole removal, please highlight that a mole, also known as a nevus, is a small growth on the human skin. An individual may be born with moles, which are known as a congenital nevi, but may develop moles over time, known as an acquired nevi. That needs to be highlighted. If we go to the first 5 bullets, please highlight all of them. But you need to make sure that you're reading that usually range in color from brown to nearly black, but can be pinkish flesh color to dark blue or even black. Dark colored moles consist of a cluster of melanocytes. Melanocytes produce the pigment melanin, which is responsible for the dark color of moles. Shape is usually round or oval or maybe smooth and rough. Size is usually smaller than a pencil eraser, but can range from barely visible to quite a large area. May form a raised area of the skin or may be flat, and may sometimes have hairs growing out of them. Also highlight that the most common types of moles are skin tags, flat moles, and raised moles. Skin tags, or acronin, are small, painless, benign growths that project from the skin from a small neural stalk known as a peduncle. If we go on down, please highlight where it says, although most moles are benign, some moles may be precancerous or known as a dysplastic nevi. A dysplastic nevi are usually larger than normal moles and have an irregular coloration and shape. The center of dysplastic nevi may be raised and darkened. According to the National Cancer Institute, dysplastic nevi are more likely than ordinary to develop into malignant melanomas. In dermatology, you hear this phrase a lot. And that's why it's important for everybody to get a full body skin examination once a year, even if you don't have a history, a family history, or personal history of skin cancers. And then your dermatologist may provide you to have a more frequent checkup depending on your family and personal history. All right, so now we're going to go on down to the following. Please highlight asymmetric, irregular border, color varies, diameter, and other signs where the mole is painful or tender, itches, bleeds, oozes, or has a scaly appearance. And if you look on page 360, figure 10.25, the ABCDs of melanoma. Please review that and read that. We're going to go on down to the procedure mole shave excision. A shave excision is most commonly used to remove protruding moles. It can also be used to remove skin tags. That needs to be highlighted on page 360. If we go on over to page 361, please highlight under the laser mole surgery. A laser surgery is used to remove small or flat moles that are brown or black. If we go on over to needle biopsy, a biopsy is removed in examination of tissue from the living body. The tissue usually is examined under a microscope. Biopsies are most often performed to determine whether a tumor is malignant or benign. That needs to be highlighted. If we go on over to page 362 under the ingrown toenail removal, please highlight where it says external pressures such as from tight shoes or trauma, improper nail trimming, or infection can cause an ingrown toenail. And if you look on figure 10.26 and 27, that kind of tells you what it looks like and how the ingrown toenail is removed. Now we're going to go on over to page 363 under the postoperative instructions, ingrown toenail. Please highlight number 1, 2, 3, 4, 5, and 6. We're going to go on down to a colposcopy. Is the visual examination of the vagina and a cervix by means of lighted instrument with a binocular magnifying lens, known as a colposcope. That needs to be highlighted. If we go on over to the other side of page 363, please highlight that a colposcopy is performed after an abnormal pap test result and to evaluate vaginal or cervical lesions observed during a pelvic examination. And then we're going to go on over to page 364. Please highlight number 1 and 5 under the procedure for a colposcopy. Excuse me. Then we're going to continue for the cervical punch biopsy. A cervical punch biopsy is performed in combination with the colposcopy to remove a cervical tissue specimen for examination by a pathologist. The purpose of the biopsy is to detect the prevalence of cervical dysplasia or cancer of the cervix. That needs to be highlighted. If we go on over to page 365, please highlight number 3 under the postoperative instructions for cervical punch biopsy. And then cryosurgery. Cervical cryosurgery, also known as cryotherapy, uses freezing temperatures to treat certain gynecologic conditions. Cryosurgery is most often performed as a treatment of cervical dysplasia. That needs to be highlighted. Now we're going to go on over to page 366 under the postoperative instructions for cervical cryosurgery. Please highlight number 4. Do not douche, use tampons, or have intercourse for 2 to 3 weeks after the procedure. We're going to go on down to skin lesions. Highlight that in the medical office, cryosurgery may be used to remove benign skin lesions such as common warts and skin tags. It's what we call in dermatology, which is liquid nitrogen. And we use that to treat just that benign skin lesions, warts, skin tags, and even some precancerous type skin lesions. We're going to go on over to page 367 for bandaging. Please highlight where it says the function of the bandage may be to apply pressure to control bleeding, to protect a wound from contamination, to hold a dressing in place, or to protect, support, and immobilize an injured part of the body. Please highlight number 3 for guidelines of the application. Bandage turns. Please highlight the circular turn is applied to the part of the uniform width, such as toes, fingers, or the head. Each turn completely overlaps the previous turn. 2 circular turns are used to anchor a bandage. We're going to go on down to the 3rd bullet point where it says a spiral reverse turn is useful for bandaging a part that varies in width, such as the forearm or lower leg. The very next bullet point, please highlight that in general, the figure 8 turn is used to hold a dressing in place or to support or immobilize an injured joint, such as an ankle, knee, elbow, or wrist. Please become familiar with the figure 10.32, 10.33, 34, 35, and 36. And then as well, please continue to read procedure 10.8. And that concludes chapter 10.